Okay, so now we're testing for deep sulcus. That is a tilted or twisted towards sacrum. So you're gonna have your person turn onto their tummy for you, please. And then they're gonna hang their feet off the end of the table. So you do want their feet all the way off. I am gonna scoot him this way just a little bit, and he can adjust his hips from there. And then you can see he already has his head up on his arms, so you have them with their chin on their arms. People will want to put their head down because it kind of makes it tight in the low back, but you want them like this to exaggerate this curve of the spine. Now you actually hop up on the bed for this one, and then we're palpating on the sides of the sacrum. So we're right in the glutes. Now, if you're in the right spot, it shouldn't be very tender. So you're looking for a deep sulcus, which is just Latin for hollow. Sulcus is, and we're looking for whichever one, if there is a deeper side than the other. Is that spot tender? Is that okay? Okay. So I know I'm in the right spot. I always check, because if it's like, oh, then you're in the glute muscle, not in the sulcus. And so it should feel like a little hole. This one does take a lot of practice and awareness, and bodies are different. So it's wider on some people than others. So then I gently sink right in, and I see if one finger goes deeper than the other. And today my left finger is sinking quite a bit deeper. And again, like the symphysis, this can be very subtle. Sometimes it's quite obvious, other times it's quite subtle. And if you're not sure, you can always do a gentle correction. But oftentimes, if you're not sure if there's even a twist, unless they're getting a ton of sacral pain or the other corrections do not alleviate their symptoms, then you often don't need to do this test. It should be a pretty pronounced twist, or sometimes they've gone to a chiropractor, or maybe you are their chiropractor and you know they have a twist of the sacrum, then you can go ahead and correct it. But so anyways, today his was on the left, so that is the deep side. That tells us that his sacrum is twisted, actually kind of twisted to the right, because it's higher. There was more space to sink down. So we'll be correcting that.